And what we see here, are your lungs completely symmetrical? Is the left identical and a mirror image to the right? Well, what we see here is that they're similar, but they're not identical. They're not mirror images. Well, one thing you can tell is that look at these little separation between the lobes. You see that there's actually 3 lobes on the right lung and 2 lobes on the left. And also the left lung has what you call a cardiac notch. And what does cardiac refer to? What do you think fits in this cardiac notch? Maybe something we refer to as cardio, right? So again, go back to this. This is why the lungs that you have the cardiac notch. And this is, remember that your heart goes slightly down and to the left. So that's why you have that cardiac notch. It's your lungs making a little room for the apex of the heart to poke into the left lung a bit. But again, you don't want it to interfere with each other. So that's why it makes room with the left lung. And this is another neat section. So what they did, this shows you how closely your lungs and heart work together. Remember, your lungs are there. One of the big functions is to oxygenate the blood pumped out by your right ventricle, right? So this is the great thing about how your heart and lungs are arranged. There's not that much distance to travel between your heart and your lungs, so you have very fast return delivery of blood to the lungs and from the lungs. Okay, so then again, your lungs are not mirror images of each other. In people with typical anatomy, you have 3 lobes on your right and 2 on the left, and this is how I remember it. Remember, your heart points to the left and it takes up a little more space. That's why, and this isn't the exact reason why, but this is how I know that the left lung typically has 2 lobes. Because the heart is there taking up a little room, it has 1 less lobe. Again, that's not the exact reason, but that's my little mental mnemonic of why there's 2 on the left and 1 on the right. And what we have here, so again, you have that little indentation from the heart right here. So what we're looking is actually if we took the 2 lungs and now you're looking at them this way. So you're looking at from the inside toward the outside. And again, you have our pulmonary and arteries and veins leading from your heart to the lungs and to and from the lungs. And this part is, I think the OpenStax version has a picture, but I think this is more FYI. So what we see here is that you have multiple segments that branch off from the bronchi from the lungs. Again, it's not exactly the same. Your lungs aren't mirror images of each other.